National Advisory Committee on Immunizations a few weeks ago made an announcement. They basically said, listen, COVID's we'll see a rise in cases in the fall. There's going to be an updated vaccine available. It's a booster campaign in the fall. They recommend that people go out and get this vaccine, but they were very clear to strongly recommend that those who are older or at greater risk for infection or who reside in long-term care facilities, a few other groups as well, that those individuals go out and get the vaccine. We know
COVID cases are likely to be on the rise, says a conflict of interest riddled expert who the mainstream media pharma pushers continue to amplify. Tamara Ugolini here with Rebel News to highlight a recent article published by CTV News titled, "Canada will likely see a rise in COVID cases by late August, infectious disease expert." And yet, nowhere in the article did they disclose this purported expert's declared conflicts of interest. But we'll get to that in just a minute, because first, here is what the infectious disease expert, Dr. Isaac Bogusz, had to say as we head into the fall with new scariants like EG5 on the horizon, further being used to justify the necessity of now seasonal novel COVID-19 boosters. Have a listen.
Yeah, this virus is going to continue to impact Canadians. And of course, it's going to disproportionately impact those who are more vulnerable to the virus. Those are older Canadians, and those are people with underlying medical conditions that put them at greater risk. The National Advisory Committee on Immunizations a few weeks ago made an announcement. They basically said, listen, we'll see a rise in cases in the fall. There's going to be an updated vaccine available. It's a booster campaign in the fall. They recommend that people go out and get this vaccine, but they were very clear to strongly recommend that those who are older or at greater risk for infection or who reside in long-term care facilities, a few other groups as well, that those individuals go out and get the vaccine. We know the vaccine, of course, doesn't do the same as it used to in terms of protecting us against infection and onward transmission. It still does to a little bit, but not to the same degree. But the vaccines continue to provide significant protection against more severe manifestations of the virus, like hospitalizations and death. And we can expect the vaccine to continue to provide that same level of protection, especially for the most vulnerable Canadians.
Flashback to May of 2021, Bogusz admits that he's a vaccine promoter. Look at this.
Again, I've been promoting. I think that's how we get to the answer. Take the first one that's available. It's through that thought process of going through risk, benefits, alternatives, and context. That's what lands you at take the first vaccine.
Yeah, but that's not what they said, Dr. Sharkawi. They said, take the first vaccine unless you're in a low area. Who determines that? And these aren't the preferred.
Vaccination is our way out of this pandemic. We have to get as many Canadians vaccinated as quickly as possible. Any step towards speeding up the vaccine process, ensuring it's done in an equitable manner, getting access to more vaccines, using the vaccines we have in a smart way, like that's clearly the right direction. I mean, I think we can improve our communication. I think we can improve our community engagement. I think we can enable people to make good decisions and smart decisions. But operationalizing that is going to be challenging.
Watch his eyes widen toward the end of the interview when host Evan Solomon says that we're getting a lot of Pfizer and Moderna.
Right, and because we're getting a lot of Pfizer and Moderna, so we'll find out when Dr. Bogusz and Dr. Sharkawi.
That's probably because he was a pandemic profiteer. Remember when Ontario Premier Doug Ford said that he was relying on the supposed experts but refused to name them? Well, it turns out that he was relying on the now disbanded Ontario Science Table, of which Dr. Isaac Bogusz was a member, with the following declared conflicts of interest related specifically to COVID-19. A grant paid directly to him and his institution by the Canadian Institutes of Health Research, or the CIHR, to study the global spread of COVID-19. Side note here, he was paid $278,000 on February 1st, 2020, nearly 2 months before the COVID hysteria hit Canada, by the CAHR for this study. He was also given $543,150 for a consultancy fee paid to him. He was also paid by the NHL Players Association to review their protocols to ensure safe play. Remember when the professional sportsters could play hockey, work out in a gym, eat in a restaurant, but all of the children were shuttered out of the arenas? their parents as well if they didn't comply with vaccine passports, while gyms and restaurants were indiscriminately put into forced public health lockdown. And then there's another consultancy fee to Blue Dot, the same company that was hired by the Public Health Agency of Canada to monitor and track the cell phone data of unsuspecting Canadians to measure their compliance with public health measures like social distancing, quarantine, and travel restrictions, stay-at-home orders.
The Public Health Agency of Canada confirmed media reports just before Christmas that it had secretly accessed location data for 33 million mobile devices to monitor the movement of Canadians during COVID-19. That number represents roughly 87% of the population who were spied on without any knowledge that the government was accessing their data. Public Health Agency of Canada officials were forced to admit this had occurred after a request for proposal was published with a call for interest in continuing a program of collecting data for up to 5 more years.
How in the world could such a small group of people with limited resources change world history? But in fact, that's happening, and it's the power of the truth. The truth is like kryptonite.
Healthcare isn't in some sense working very well. Foster Colson is thinking about this. He's got a new company, an online healthcare platform called The Wellness Company.
Telehealth company called The Wellness Company.
The Wellness Company.
The most popular product is the detoxification supplement that features nattokinase. Nattokinase is the only enzyme that we're aware of right now that dissolves the spike protein. Spike protein is loaded in the body with the COVID-19 infection and definitely with the vaccines. We've been completely accurate on the spread of the virus, early treatment, on the deficiencies in hospital care, and now the deaths that are occurring after vaccination. This is a human outrage, and it's occurring at the end of a hypodermic needle. Isn't it interesting? Natural substances combating this man-made disaster.
In a now deleted Government of Ontario webpage, Bogish was also the member of the COVID-19 Vaccine Distribution Task Force, whose primary function was to advise the Minister of Health and Solicitor General on how to develop and implement a COVID-19 immunization strategy where non-Ontario public service employees were paid $398 per day. I reached out to Dr. Bogish to clarify how the above-mentioned grants and declared conflicts of interest may interfere with his ability to provide non-biased, neutral recommendations on COVID-19 injections. He responded clarifying that he does not consult to pharmaceutical/vaccine companies, nor does he get paid for media engagements. Dr. Bogish also states that he is not a member of Canada's National Advisory Committee on Immunization. That's also called NACI. The grants that he received from CIHR pertain to evaluating new methods to prevent HIV infection, evaluating how COVID spreads globally, and evaluating new diagnostic tools for parasitic infections, primarily in African settings and among immigrants and refugees. Yet it certainly sounds like Bogish is captured by a pharma-centric narrative, kowtowing to the government-favored consensus by the same institution that has recently funded training opportunities in science communication, awarding tens of thousands of taxpayer dollars to social media influencers and consensus parrots aimed at combating misinformation on social media. For Rebel News, I'm Tamara Ugolini. The state-backed media like CTV and CBC have been crucial amplifiers of misinformation to garner public support for their liberal funders. The misinformation espoused by the state broadcaster is why we launched a petition to demand that the CBC stop lying at cbclies.com. There you can check out all of our reports on the topic and chip in to support our independent and non-government captured journalism. That's cbclies.com. Thank you for your continued support.